Montgomery County is committed to preparing our community for a potential influenza pandemic. Specifically, by providing this informational video to medical and healthcare professionals, the county is dedicated to making sure every organization in our community has the information it needs to prepare for and handle the effects of a pandemic. A pandemic would present many challenges for our citizens, for our healthcare system, and for our economic stability. So the goal of our plan is to reduce the impact that a pandemic could have on all areas of our society. And most importantly, by preparing for a pandemic, we are also preparing for our more common disasters at the same time, such as storms and power outages. This is called the all hazards approach. We want to provide you with important facts about pandemics, an understanding of what you can expect should a global pandemic occur, and how to prepare pandemic readiness strategies for your organization. Remember, the best defense is a good offense.
So what is a pandemic?
A pandemic is a worldwide outbreak of severe infection that can occur when a new disease appears to which people have not been exposed before. Because people are not immune to the disease, it can cause serious illness and death among millions of people. There have been several influenza pandemics in the past century. While most experts agree that there is a growing and significant threat of a global pandemic, it is impossible to predict with certainty either when it may occur or how severe the impact on our citizens. With this in mind, it's important that we begin to prepare for such an event. Controlling the spread of an infectious disease requires a mutual effort that includes hospitals, physicians, municipal government, emergency management, law enforcement, emergency medical services, schools, and businesses. Should a pandemic strike, much is at stake, including the potential human toll predicted by the government to be up to 2 million deaths and 10 million hospitalized in this country alone. The economic damage may be severe, with 70 to 110 billion in losses possible. Much of the population will likely be affected. Therefore, we need to continue to focus on broad issues such as medical staffing, policies regarding who receives vaccines and its distribution, mandatory school and business closures, travel restrictions, care of families, and the handling of deceased victims.
What are the patient's symptoms during a pandemic or with avian influenza?
The onset of symptoms, which occur about 10 days after exposure, vary among patients but generally include sudden high fever, cough, sore throat, body aches, and chills. In some cases, eye infections have been reported. In severe cases, lung involvement with pneumonia and possible pulmonary failure.
What are some of the complications that influenza patients can have?
Thank you.
Thank you.
One major complication of influenza is pneumococcal disease, including pneumococcal pneumonia, which left untreated is one of the most common causes of death in America. Pneumococcus is found in many people's noses and throats and can invade different organs. Why it suddenly invades the body and causes disease is unknown, but it may have to do with a weakened immune system, which can occur when a person contracts influenza. The good news is that pneumococcal vaccine is very good at preventing severe disease, hospitalization, and death, although it is not guaranteed to prevent all symptoms in all people.
There is a pneumococcal vaccine, but who should receive it?
Pneumococcal vaccine is recommended for certain patients as follows: everyone age 65 or older, Alaskan Native and certain Native American populations, those with chronic disease such as heart disease, sickle cell disease, diabetes, leaks of cerebrospinal fluid, lung disease, except for uncomplicated asthma, also alcoholism, liver cirrhosis, immunocompromised patients with Hodgkin's disease or other lymphoma, multiple myeloma, chemotherapy or radiotherapy, corticosteroid treatment, bone marrow or organ transplant, kidney failure, leukemia or other cancers, nephrotic syndrome, damaged or no spleen, or HIV infection or AIDS. The vaccine for pneumococcal disease does not protect a person against avian influenza. In April 2007, the FDA approved the first vaccine against the H5N1 strain of avian influenza. However, it is not yet commercially available. It has been purchased by the federal government for inclusion within the national stockpile for distribution by public health officials if needed. If a pandemic strain of the virus emerges, a vaccine must be tailored to that strain. This process takes several months.
If there is a pandemic, what will be happening around me?
Since a pandemic is global, there may be disruptions to daily life activities, including in Montgomery County. There may be very high infection rates. It is predicted that 25 to 60% of the population will be infected and many will require medical care. Many might die. Healthcare providers will likely be overwhelmed with people seeking urgent care and may not be able to help everyone. Vaccines and other medications may not be readily available and may not be available to all segments of the population. Equipment and supply levels may be inadequate to accommodate the increased demand for services. There may be an increased need for security in healthcare. Your organization may need to communicate and coordinate with other health-related facilities, including competing healthcare entities. Possible government interventions may include quarantine, isolation, travel restrictions, and closing of borders at country, state, and even county levels. On-call and backup resources may be limited. Businesses and schools may need to close due to shortages of staff and concern for the health and welfare of their employees and students. Food and water supplies may be interrupted and limited. Hospitals and other healthcare facilities, banks, ATMs, restaurants, government offices, post offices, and service providers may all be affected by reductions in staff due to illness. While it is likely there will be some advanced warning before a pandemic, it will affect our county. It is important to create key pandemic readiness strategies now. The Montgomery County Departments of Health and Public Safety are committed to assisting all members of our community in preparing for an influenza pandemic event. Preparation and readiness must become a way of life for every medical and healthcare professional in Montgomery County.
What action should my organization be taking now to prepare?
A catastrophic public health event, such as an influenza pandemic, could severely impact the resources of the community safety agencies and healthcare system. An event of this magnitude is referred to as a mass casualty event. Under these circumstances, community planners may have to allocate resources in a manner that is different from the usual circumstances. The following strategies will provide your organization with a framework to plan for and respond to a mass casualty event as a result of an influenza pandemic. Initiate proactive planning. Be proactive and start planning ahead of time. Anticipate shortages in public safety and healthcare resources and identify policy and operational adjustments that will need to take place in response to these shortages. Build and maintain relationships. Forge partnerships, inter-hospital agreements, and other relationships with key stakeholders from the healthcare system, emergency management system, federal, state, and local public health systems, local emergency responders, emergency medical services, home health care, and other medical providers, in addition to volunteer agencies, public safety, law enforcement, and other public and private partners at all levels. Establish clear messages and communication strategies. Inform the public in a timely manner about the status of the event and what actions they should take. Work with the media, 911 dispatchers, special information phone lines, and other communication mechanisms to share clear and accurate messages.